Well, President Cyril Ramaphosa has welcomed the announcement that the Biovac Institute in Cape Town is set to manufacture COVID-19 vaccines. In his capacity as African Union champion on COVID-19, Ramaphosa says this will help overcome global vaccine inequality, especially here in Africa. The institution aims to produce 100 million doses of Pfizer vaccine annually. It's all going to be distributed around the continent. Biovac will acquire drug substances from BioNTech's facilities over in Germany and begin manufacture, we understand, next year. I spoke to the Biovac CEO earlier. To help break down how important this agreement is, I'm joined by the Science and Technology Department's Deputy Director General, Dr. Mmboneni Muofhe. Doctor, good morning to you. I spoke to the Biovac CEO just a short while ago. He was giving us the mechanics around how this is all going to happen in the next year or so, but I cannot imagine what a difference it's going to make, A, to South Africa and B, to Africa as well. How happy are you about this decision?
Good morning, Gareth, and to all the audience of eNCA. This is really a very exciting development for South Africa and for the continent. And I think you probably would know, it's common knowledge that we have as a continent been left behind with the distribution simply because everything that has to come to the continent was coming from outside the continent, predominantly from Europe and then at some stage from India. So this really set us up on our long-term goal of being one of the global hotspots for manufacturing of vaccines, not only now, but going forward.
And when it comes to the kind of supply chain that many people are talking about as well, we are saying 100 million vaccines for the rest of the continent and Africa as well. The Biovac CEO is saying, apart from the technology, Deputy DG, there's also a lot of planning that's going to go into the distribution and the transport of these vaccines. Where do you come in as the Department of Science and Technology? How are you assisting with that?
So our main focus as the Department of Science and Innovation is to make sure that we actually are able as a country to move from doing fill and finish to actually reaching a point where we can actually manufacture the active pharmaceutical ingredients in South Africa. So that's really what our biggest goal is, which is why this decision or this announcement yesterday should not be taken as in isolation. We should also look at the announcement that was made by the President on the 21st of June relating to South Africa being the first country to be hosting what will become the first hub for tech transfer of the mRNA technology. So that is now going to move us from just doing fill and finish to actually the manufacturing of the active pharmaceutical ingredients. So that is the long-term goal from government, to that we need to be able to manufacture everything pertaining to vaccines, including developing in future our own vaccines. So that basically is the end game that we're looking forward to. And that's why this particular aspect, it enables us to go on that path of backward integration.
I'm so glad you raised the point, Deputy DG, of producing our own vaccines. So Biovac and Pfizer teaming up, it seems, in about a year from now, we'll see those vaccines coming out. Where are we, if you could maybe just add some meat to the bone of our own vaccine, an African vaccine, or even a South African vaccine, if you will. Where are we on that? I know it's a big goal of your department, isn't it?
That's the ultimate goal of our department. So in terms of the other vaccines, you probably might be aware that the department is actually holding the shares in Biovac on behalf of government. And we have had a number of tech transfer arrangements. One of them, interestingly, also with Pfizer for the Prevnar vaccine. And then we also had concluded one with Sanofi last year on hexazen vaccine. So we are moving slowly towards that path. As I said, we're doing it from a backward integration point of view. But we also need not forget the fact that South Africa has had a long history of vaccine development, one looking at TB, even the partnership that Biovac had, for example, with the likes of Bill and Melinda Gates Foundation, where we were developing the BCG vaccine. And then we also have been working for many years with a very elusive vaccine for HIV and AIDS.
Yeah.
So the know-how, some level of know-how does exist in the country. However, when we are going to have the tech transfer arrangement, this is going to be a much bigger boost towards reaching that goal. For example, as soon as we start implementing the work of the tech transfer hub that was announced, one of the things is that we are going to move from looking only at COVID vaccines and begin to consider vaccines like flu, and then again many other vaccines for the new diseases breakout that we are anticipating should be happening at a much higher frequency than we had in the past.
So it looks like this technology transfer, that centre, the Biovac situation, as well as Pfizer, are going to have effects and positive effects outside of COVID-19. It's good to hear. And we'll be touching base, I'm sure, again with the Deputy DG at the Department of Science and Technology, Dr. Mmboneni Muofhe, joining